Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic Clinic. This video has to do with frozen shoulder. Everything you need to know about frozen shoulder, so stay tuned. All right, let's talk about frozen shoulder. Is frozen shoulder a shoulder problem or a problem somewhere else? How about that? So frozen shoulder, essentially, for those of you who may not know all about it, is limitation in the shoulder joint range of motion. So it doesn't have to be fully limited that you can barely move it, but it could be limited, like you go this far up and then it's painful, and obviously you don't want to go through the pain, so you stop doing it that way. Frozen shoulder is a shoulder pain, but really the source of that, the cause of it, the contributing factor is a neck issue. Why? Let's talk about the anatomy here. You've got your clavicle or collarbone that goes all the way towards the shoulder joint, and your scapula or shoulder blade has sections of it that really form with the clavicle, form what's called a fossa, a socket. So this bone at the end of it has a ball. So this is your humerus with the humeral head that sits inside the socket. This is just the normal anatomy of the shoulder joint. So in today's society, where we're sitting down with the shoulders rolled forward, in today's society where we have a name for everything, but we don't really trace it back to where it came from, we end up with shoulder joint limitation of movement. So what ends up happening is, instead of this ball inside the socket, instead of it being centrated, properly located within the socket, when the shoulder is rolled forward, this ball is no longer centrated. It shifts its position, the socket is moved forward, and the positioning of the ball inside the socket changes. One thing that ends up happening is, instead of the bone touching the bone, there is a bunch of soft tissue right in that space. And we end up squishing and irritating and compressing those soft tissue, and that's where the pain comes. So frozen shoulder is a soft tissue issue that is resulted as because of a postural decline within this area, not just the shoulder, but the neck also. How does the neck play a role? As the curvature in the neck and the cervical spine changes, so does the positioning of your collarbone. So if my neck is forward, the muscles here that are connected to my collarbone will pull, or depending on what else is going on, push the collarbone and compromise the postural presentation of the shoulder joint, and that's how you end up with it. What do we do in the office? It's very simple, painful, but simple. What I do is what's called functional rehab. So I go in and use techniques like active release techniques like, I'm not a big fan of Graston, but using instruments to get in there and have the patient go through movements, specific movements, depending on what the situation is after the assessment. Pressing and isolating that muscle from any other helpers, and have a main muscle do its main function and go through a cleaning up process. Once that's cleaned and range of motion is decent enough, in insurance model, they say, okay, patient has a normal range of motion, all right, you're done. In my practice, we're not done, because that's just the beginning, because now the shoulder joint needs to talk with the surrounding tissues. It's a concert. Movement is a concert. So in a concert, all musicians play a role, and all of them at the right time chime in to make that musical presentation a good one. So does a movement. So when the shoulder joint learns to properly at the right time come in and chime in when there's a specific movement in the neck, smooth proper movement in the scapula, proper movement of the torso, now we're in a better shape. How do we bring that to the picture? Through what's called developmental kinesiology or dynamic neuromuscular stabilization. You might have heard there are other techniques that this is achieved. You can learn more about DNS from my website. I'll make sure you have information in the description box. But that's the essence of frozen shoulder. We typically say, oh, that's a middle-age problems, mostly seen in women. That's all bullshit. That's what it is. Let's just stop labeling these and get to the root cause, address it, and get rid of the cause and learn how to use our body. For goodness sake, you're using your phone more than likely to watch this video. You have taken the time to understand what apps are available and what other apps to add into what you have on your phone. Your body comes with certain apps you can't even delete. Proper movement is one of them. So instead of trying to monkey around the operation, try to come up with something fancy schmancy, go back to the basics and use what every child does, every infant does, proper movement to move properly. Anyway, frozen shoulder is not a shoulder, is not caused by a jacked up shoulder joint. It's caused by a jacked up neck and upper mid-back issues showing up in the shoulder joint. It's the soft tissue problem, has nothing to do with age, has everything to do with failed posture. Anyway, that hopefully has answered some of your major questions about frozen shoulder. Please make sure you subscribe to the channel, you share this video with those of your friends or family members who have the so-called frozen shoulder.